guys, Dr. Dobson, and we're going to be restoring yesterday's case in this video. Here's some sped up footage of that. And then today we're going to be going over the restoration. So there's the bridge, and we're going to be installing it and going over what's involved in making it in this video. So here's the case. This is the initial panoramic x-ray that we took. There's post-surgery. We placed 6 implants on the top and bottom arch. And then there's after the restoration that we'll be going over in this video. So we get the patient back in 3 or 4 months, and we take the healing caps off. Everything looks good and healthy. The gums look good. ISQs were all green, so we didn't have to lose an implant. We'll take a scan with these little scan bodies in the implants, and then here's the scan output. You take an initial, and then you align it with the scan bodies, and then just take a bite scan that I do just using popsicle sticks habitually until it auto aligns. And I have about 30 or 40 millimeters of clearance between the arches. That 2-1 site was a little bit buccally oriented than we would have liked, so that's actually going to be, the screw hole is going to be coming out the cheek side, which he was okay with, but we'll send it to the designer and he'll design our unit, and then we'll mill it out. So here's the lower unit, and then the upper still attached to the stabilizers, the heat stabilizers. I use this stain that I put on the Green State product, and there's post sinter. He wanted them as close as we could get it to the original, and he was reasonably happy. So we'll install the fixtures here. We'll get the patient back once they're all ready to go. I bond the tie bases into the abutment cavities, and then polish it. And they're ready to go. So we take the healing caps out, and then basically we just put the bridge in and screw the screws down onto the abutments. These are all tissue level, which I'm a big fan of. I try to make these things as kind of sleek as possible, with enough thickness for strength. I see people restore full arch implants with these massive acrylic dentures essentially, and I don't get the point because it's such a soft material, you can't really grind anything with it, and the speech is affected. So we'll torque the 6 screws down to about 15 Newton centimeters first, and we'll put the upper in next. I'll usually torque them to 15, give them a good shake, and then torque them to 35. So we'll seat the upper, and we'll just hand tighten all the screws first. There's the 2-2 screw channel coming out the buckle that we'll cover up with some composite, and then we'll torque the fixation screws down to 15 first, and then we'll check the bite. The bite was actually off, so we had to do a bunch of adjusting when that happens, and that's okay, just as long as you can get it even contact at the end. So we did a whole ton of adjusting, and we ended up getting a good even bite. So it's functional, he's happy, and these will last for a super long time. Give him a water pick and tell him to use it every day. There's the post-installation macros, and there's some residue from the adjustments there. I actually installed these myself without an assistant because we were excited to get them in. So that's this one. Thanks for watching.